Okay, so good afternoon, everyone. Happy Sunday. Hope you're all doing well. Thank you for joining our fifth COVID-19 vaccine Q&A forum. I'd like to introduce myself. My name is Meera. I am a community health worker with Health Access Thorncliffe Park. And my co-moderator today, I'm going to pass it over to herself to acknowledge herself.
Hi, everyone. My name is Iman Khan. I'm the Events and Communications Specialist with the Flemington Health Center, and I'm very happy to co-moderate the session today.
Perfect. Thanks, Iman. As we begin, I'm just going to share a land acknowledgement. We acknowledge that the land on which we gather and work is situated upon traditional territories. These lands were originally the homes of the Wendat, Anabashabek, Haudenosaunee, Métis, and the Mississaugas of the New Credit First Nations, and continue to be. Today, the meeting place of Toronto is still the home to many Indigenous peoples from across Turtle Island, Canada. We are grateful to have the opportunity to work in the community on this territory. We recognize that many of the barriers faced by newcomers in their settlement on this territory continues to be faced by Indigenous peoples across this land. We make this acknowledgement because we are committed to anti-oppression, anti-racism, and equity in all aspects of our work. So again, thank you so much for joining us. I'm just going to go over a quick few housekeeping rules before we start introductions of our panel. So today's session is being streamed on Facebook. So please, if folks are not able to join us today, please let them know that they can catch the recording on Facebook as well as our YouTube channels. Our format today will be pre-submitted questions that have been sent through our groups. Our panelists will answer those. Once those have been answered, then we will go to our live Q&A box. So please, if I would encourage you to use our Q&A box and not the chat box, just so that we don't miss any questions, as well as our panelists can answer your questions live. So I really encourage folks to use, please use the Q&A box. And again, at the end, we'll do some wrap up, we'll share some resources, and then we'll let you enjoy your Sunday afternoon. So with that, I'm going to ask our panel to please introduce themselves, and I'm going to pass it over to Dr. McCready to begin.
Perfect. Thank you so much, Meera, and thanks for having me. My name is Janine McCready. I'm one of the infectious disease physicians at Michael Garron Hospital, and I've been at Michael Garron now for nearly 10 years. And then throughout the COVID-19 pandemic, I've had an opportunity to spend more time working with the community, so learning lots more about Thorncliffe and Flemington communities. And I've had the privilege really to work with all the schools in the area and the amazing parent groups and principals, and really try to make sure that we can, keep all of you safe and keep the schools back to a normal, as much of the normal year as we could possibly have next year, so that kids can get back to learning and we can have a really great year next year and get them back to being kids again and not worrying about all this COVID stuff. So, thanks for having me.
Thank you, Dr. McCready. And then we'll pass it over to Dr. Shah.
Hi, my name is Meera Shah. I'm a family doctor at Health Access Thorncliffe Park, which is in East Yorktown Centre. And we also have a school clinic in Thorncliffe Park Public School, where we were seeing kids from the school. And so we've been working actively with HETP and Michael Garron Hospital and Dr. McCready to try and get as many people in Thorncliffe vaccinated, and really happy to share information and answer questions today.
Perfect. Thank you so much. And then Tabasum, if you could introduce yourself, please, and thank you.
Thank you, Meera. Hi, everyone. My name is Tabasum. I'm the lead community ambassador for Thorncliffe. We are working out for the outreach in Thorncliffe and vaccine rollout. Right now, I just came back from the pop-up clinic and I have to go back after this meeting. Yeah, thank you for having me.
Thank you. I can't wait till you share your story, Tabasum. Hard at work. Thank you for joining us today in between your two shifts. With that, I'm going to pass it over to Iman, and she's going to start with our pre-submitted questions.
Thanks, Meera. So my first question is for you, Dr. Shah. Can you share with us any updates with the AstraZeneca vaccine? particularly if we were to run out of supply and people are in need of a second dose of the AZ vaccine? Do you have any guidance for them?
So just to back up a little bit, so obviously our vaccine rollout is highly dependent on the supply of each vaccine. And currently we are using up all of the AstraZeneca doses to give offer second doses to those that were vaccinated March 10th to 19th. And we're not clear on if and when we will get more supply of AstraZeneca. So, but there is a major trial underway in UK looking at whether COVID vaccines can be mixed with different types of vaccines. So AstraZeneca first and Pfizer second. And so far it has been positive. And, you know, we really do hope to get the results of that soon and have NACI approval with mixing vaccines. And so be able to offer those a second dose of Pfizer or Moderna, and whatever NACI does recommend to us. And it would also be offered sort of at the ideal time frame that's suggested to us. So I'm anticipating around 10 to 12 weeks, but you know, we will wait to hear from NACI and what they suggest.
Awesome, that sounds very encouraging. So how will folks know when to get their second dose? Do they just go into a pop-up and request a second dose?
So for folks who received their first dose through Michael Garron Hospital or any of the pop-ups or clinics that are run through Michael Garron or ETHP, they will be contacted over the next 2 weeks for those who are eligible. And based on the time of when they received the first dose or their age group. And so they will be contacted either via email, which was given when they received their first dose, or a phone call. And you know, we hope that folks will be contacted in that order shortly. If you do find that you received your vaccine 12 weeks ago and you haven't been contacted in 2 weeks, then you know, I would obviously reach out to ETHP, but make sure you're answering your phone, checking your email, because we do really want to reach out to everyone.
Yes, the next question I have here is, and you may have touched upon this already, does the second dose have to be the same brand as the first one? So you're saying there's still some research going on around this. Did you want to add to this question?
Yeah, I mean, the only thing I will add is that, you know, we've been getting vaccines for hundreds of years, right? Kids have been vaccinated from a young age, and they get repeat doses and booster doses of vaccines, and it's often different vaccines that are being given. So they may get one kind of vaccine for their first shot, and then for the booster it would be a different manufacturing company that would give it. And so that's been happening for hundreds of years. And so, you know, I do anticipate that very soon we will be giving and mixing doses with us, mixing vaccines for COVID, and giving people options of which one they'll get. So we're waiting on results from England, but they are looking positive so far. And I hope that NACI will be letting sort of everyone know of what the guidance is shortly.
Awesome. So there was quite a bit of concern around the intervals between the first and the second doses. And one of the questions that we got was, why can't I get my second dose at 4 weeks as recommended by the manufacturer?
So the original studies for Pfizer had given the second dose at shorter intervals, but follow-up studies have shown that actually waiting longer intervals for your second shot provides better efficacy at preventing COVID and preventing hospitalization from COVID. And so, you know, that's one reason. So on an individual basis, it's actually shown to be better if you wait a bit longer. And then the second reason is really with limited supply in Canada, it made more sense to vaccinate more people with 1 shot than to vaccinate fewer people with 2 shots, because, you know, providing broader people and getting larger immunity amongst a broader population was really, it was predicted that we would reduce hospitalizations to a much larger extent. And I think so far that has worked. And so, yeah, I hope that answers that question.
Yeah, thanks, Dr. Shah.
Perfect. So Dr. McCready, your turn. So the first question is, can you share with us, how did the process change to get our 12 to 17-year-olds vaccinated? I feel very hesitant as it happened so quickly.
Sure. So, I think that with everything with COVID, things have moved quite quickly, but there is a lot of research being done. And then all of the decisions that are being made at the time are all based on, as knowledge and information develops. So up until a couple weeks ago, what we knew about the Pfizer vaccine was that it had been, large trials had included everyone from 16 years old and up. And the vaccine was found to be safe and very effective in that group. Then they did another trial specifically in the 12 to 15-year-old range, so the younger age group, where there was about 1,200 kids that got the Pfizer vaccine and another 1,200 kids that were just the placebo group. So they didn't give them the vaccine and they watched to see if they got COVID. And among those 12 to 15-year-olds that got the COVID vaccine, none of them got COVID after the vaccination, after the two doses, which is amazing. So in that study, it was actually 100% effective at preventing COVID in that 12 to 15-year-old age group. And then when they looked at side effects or effects right after the vaccine, people would have a sore arm or a little bit of a headache or chills or a fever, similar to what we see in adults, but there was no increased concern of any serious safety issues among the people in that study. So based on that information was given to Health Canada and they reviewed all the evidence, and then they looked at the evidence for the 12 to 15 and then the 16 plus group, and that's why they decided to allow anyone from 12 and over to now get the Pfizer vaccine. So it was made, based on evidence and new information. And I think the great thing that we've seen with the vaccines that we're still going to have, we have the studies, and then we also still have lots of monitoring information. So since the vaccine was approved in the younger age group a little bit before Canada in the United States, already as of last week, there was about over 4 million youth, so between 12 and 17 years old, that have been vaccinated with Pfizer in the United States. So they're always a few weeks ahead of us, which is helpful because then on that population level, in addition to the studies, we can also make sure that there's no increased risks, no safety signal there, and they're watching very closely, and they have a very robust and good monitoring system. So the reason for the change is it was based on evidence, and at that point we have supply that they wanted to be able to give to that age group, and as well they wanted to be able to get the first dose into the 12 to 17-year-olds so that they can then get their second dose hopefully before school goes back in, so that those kids can then have as much as possible, they can have a normal school year next year. So those were all the reasons why, as I think it was May 23rd, that they opened up vaccination for over 12 in the province.
Perfect. And you kind of touched on this a little bit, but the follow-up question, were the side effects different for that age group, or were they similar?
Yeah, so great question. So they were very similar. So about 1 in 5 of the people would have some mild side effects. So a sore arm, maybe a headache, maybe a fever, chills, all very short-lived. So usually within a day up to 2 days after the vaccine, and then they were better. If people, have fevers or symptoms beyond that, you should really go get a COVID test. And if it's negative, then also see your family physician and make sure you're okay. Or if you have other symptoms that it wouldn't be expected, definitely, see your primary care physician, or if you're NOL, go to the emergency department. Though in the studies, they didn't see any major, other safety signals. You may hear a little bit in the media that they've seen perhaps some cases of what's called myocarditis in younger adults after their second dose of Pfizer. So not after their first, but maybe after their second. And so far we're looking very closely at that. Nothing has been seen after the first dose. So definitely, I have no concerns about people getting their first dose. And then people after their second dose, they're still trying to tease out whether that's actually due to the vaccine, whether it's just because we're vaccinating lots of people and inflammation in your heart is something that can sometimes happen, or because it's actually caused by people that have had COVID, because you can actually get this inflammation in your heart at probably a similar or higher rate than from the vaccine. So if you hear about reports in the media, it's not after the first dose. So definitely feel very reassured if you're, if you're deciding to get your child vaccinated. I would fully recommend doing that. And we're still going to have another few months of information gathering, and we'll learn more before we, if there is anything there, which we don't know if there is, but I think it's unlikely to. Even if there is, it'll be something very mild and something very rare. But if it is there, we will have that information available by the time any more doses are due.
Great, thank you. And then, so the next follow-up to that is, are there any trials for folks who are younger than the age of 12?
Yeah, so currently in Canada, the vaccine is only licensed if you're actually 12 years old and above. But there are studies ongoing that are looking at that younger age group. So Pfizer is doing a study down to 6 months of age, all the way up to 11. And with that, they are looking at, whether the dose needs to be adjusted because of, if the kids have a more active immune response, they don't want them to have any more side effects. So far that study is happening right now. And they're expected the results are going to be available by the early in the fall. And then Moderna as well is also doing a study with younger kids, and they just released the results of their study down to 12 years old that was very safe and effective as well. So we expect that Health Canada will be reviewing that data soon and likely lowering the age cutoff for Moderna as well.
Great, thank you so much. And then just, I know you sort of touched on this already, but sort of what will the school year look like next year in regards to vaccinations, public health measures, some of the youth getting their first dose? Maybe if you could lay that out a little bit for us, that would be great.
Yeah, so I mean, I think that there are still some unknowns, as with anything with COVID, but I am very hopeful that if we can get, a majority of the youth and adults vaccinated, then that is going to provide a lot of protection for the schools, because we know that if people are vaccinated, it prevents them from getting COVID at all, and definitely prevents from severe disease and hospitalization. So if you have the majority of the population is vaccinated, then the risk of kids going to school, going to their after school clubs, hanging out with friends is much lower. And hopefully, what I hope will happen is that, and there's lots of different, discussions with the school boards and everything, deciding how they're going to roll that out, is that there'll probably still be some precautions to begin with at the beginning of the year to be cautious. And they'll likely still want to keep kids in their individual classes, so they're not, mixing too much, to just see how things start. But I expect that their year will hopefully, and it really shouldn't be interrupted. So I would expect less dismissals. I would not think that the school should really never have to close again like they did this year. So really in-person, in-school learning should be what happens throughout the year, unless something very unexpected, were to happen. And I think even if we're not able to vaccinate the very young group, if most of the parents and their brothers and sisters are vaccinated, that's still going to provide protection to even those under 11 groups. So even the elementary kids will be able to have a more normal year if we can get the rest of the community vaccinated.
Great, thank you.
Thanks, Dr. McCready. Can't wait. My next question is for you, Dr. Shah. Are pregnant women still considered high risk for COVID-19? Should they be prioritizing their COVID vaccine whilst they're pregnant? And along the same lines, like if there's a woman who's breastfeeding, is it safe for them to get the COVID vaccine?
Yeah, so pregnant women are at higher risk of getting sick and being hospitalized and ending up in the ICU if they get COVID than someone who is not pregnant. Than someone who is not pregnant and gets COVID. And also women so COVID in pregnancy does add a higher risk, because women sort of in the later stages of pregnancy, they have reduced lung capacity. Sometimes they end up needing to deliver babies earlier than needed, and so there's risk of preterm delivery. And so, as some may have read sort of the reports at Mount Sinai Hospital in the paper, where there were a number of pregnant women who were admitted with COVID at the peak of our wave 3. And for that reason, I think we, as a province, they made a larger effort to vaccinate pregnant women. There have been many studies, as Janine has explained, that have been ongoing with vaccination in pregnancy in children. And, they've been watching it very closely. And so we haven't so far seen any risk to vaccination in pregnancy. And so we do encourage people to get vaccinated, whether they're pregnant or not. And especially family members of pregnant women, it's really important to get vaccinated so you can also protect the pregnant woman and the infant. And then, in terms of breastfeeding, I think there have been studies, even from previous vaccines, that have shown that immunity is passed on through breastfeeding. And I believe with even the COVID vaccine, there have been studies that have shown sort of at 80 days that they do find within the breast milk some immunity that's passed on to the baby.
Thanks, Dr. Shah.
Perfect. Dr. McCready, next set 2 questions are just about immunity and how close are we to achieving herd immunity? What is herd immunity? And what does that look like?
Sure. So it's you hear a lot about herd immunity, and I think that it's not maybe as cut and dry as people kind of would like to believe. So the idea of herd immunity is a level in the population that we would get to where either enough people were vaccinated or enough people have had COVID and have been vaccinated so that they can't get reinfected. And there's this, people think there's this magic number that you can get to at which COVID kind of goes away. And it's probably not as simple as that, because what we're seeing a little bit from other countries like the United Kingdom and Seychelles and a few smaller places that have had good vaccination rates so far is that if you have this virus is very tricky. So if you have a significant unvaccinated population, it's going to find that population unless you live in a place where you're totally closed off the borders and no one new can come into the country and there's no virus introduced. And I mean, fortunately or unfortunately, that's not the way Canada works. And so there's always new people coming and going that are going to be bringing in different strains and traveling from other places, and with the potential to expose other people to COVID-19. So they're likely, people have toyed around with a 70, 75, 80% level that at that point COVID will go away. I don't think it's ever going to go away, to be honest. I think that if you have whatever portion is unvaccinated, those people will still be at risk of getting COVID-19. The people that are vaccinated and that, or if you're living with vaccinated people, it would be very unlikely for you to get COVID, because after 2 doses, the vaccines are about 95% effective at preventing it and 100% effective at, or nearly 100% at preventing severe disease and hospitalization. But it's not as though it's going to melt away completely if we still have an unvaccinated population. So it's not as cut and dry as kind of this magic number. I think that the higher we get it, the better chance we have at completely returning to normal, and that then those few people that can't get vaccinated for really truly legitimate reasons, then those people will be able to have protection as well. And especially for the younger kids, until we can vaccinate them, it's really important for the parents and the siblings and everything to get vaccinated, because those young kids can't get vaccinated yet themselves. Or if you have older individuals that have an issue with their immune system, so that they can get vaccinated, but the vaccine might not work as well as it will in a younger person. So I think that the key point is really the more people, the better. And I think if we can get up over 80 or 85%, then it looks exponentially better the higher you can get that number. But I wouldn't cross the threshold and say, okay, don't worry anymore. I think we just have to keep basically trying to get all your friends, neighbors, everybody vaccinated as much as we can.
And just curious, do we know where we're currently at, what the percentage is at across the city, or
Yeah,
province? Yeah.
that's a good question. So in Toronto, we're at 65%. And so that's pretty amazing for first doses. For second doses, we're, in the very low, I think single digits probably. But in the next few weeks to the month, that's also expected to shift a bit. So, I mean, 65%, that's very good. And I think really if you look at the curve for Canada and for Ontario versus different countries in other places in the world, our curve we're still vaccinating people and still increasing that. Whereas the US, they had a big head start on us, but they've kind of maxed out now, and they're not kind of pushing ahead and getting as many extra people, where I think we're still really trying to reach people that are maybe not sure, or that maybe haven't had an opportunity to get vaccinated. And we want to make it as easy as possible for people. And then I haven't seen the data specifically for Flemington, but for Thorncliffe, someone had sent to me that the total percentage of all eligible people in Thorncliffe that are vaccinated from 12 and up is about 47%. So, and for over 18, it is 60%. So a little bit lower than what we're seeing in the city. The 65% is 18 plus. So the Thorncliffe area is a little bit lower than the city average. And so, I know we and Meera's team and you guys and the MGH team are really trying to bring the vaccines to the community as much as possible. But we really need all of you out there in the community to help your friends and neighbors and family to make those decisions about whether to get vaccinated, and then help people actually come and get vaccinated as well.
Thank you, for sure. And then just to follow up with that is, with that, do we need to continue practicing public health measures? So wearing our masks and socially distancing and all of that. And why is that important?
Yeah, so great question. So for right now, where most people have one vaccine and there still is unfortunately quite a bit of COVID circulating in the community, it is definitely very important to continue with those public health measures. So keep wearing your masks, keep distancing, you can spend time with people outside and distance, but try not to be, inside with other people especially in smaller spaces. If you are working at an essential job and you're working indoors with people, make sure that you have, a surgical mask that protects you, eye protection if you're with people where they have symptoms, if you're working in a healthcare setting. So those things are still very important. And what we are seeing from a few other countries is that with some of the new strains, and especially the B.1.167, or the strain that originated from India, is that we are seeing some people are still getting sick with one dose of vaccine. The protection is much better with 2 doses. So we're still in this spot where we just need everyone to hang on for a little bit longer. And once we get, even a month from now or 2 months from now, once we've been able to get as many people as we possibly can to get their second dose, then it's going to be much safer. And then at that point, the province has basically put together a reopening plan over the next 2 months, where as the vaccination rates increase, so more people have their first dose, even more people have their second dose, then we'll be able to pull back on some of those measures. So you'll be able to gather with more people outdoors, then be able to gather with a few people indoors, and then be able to gather indoors with more people, especially if everyone is fully vaccinated. Then it would be very unlikely you're going to transmit to each other. And so we're over the next 2 to 3 months, I think as vaccines increase, we're going to be able to see that slow lifting of all these public health measures that everyone's been trying to live with for so long, but you just got to hold on for a little bit longer.
Great. Thanks so much, Dr. McCready.
My next question is for you, Dr. Shah. And I know this question is top of mind for a lot of our community members. How are seniors who cannot leave their buildings or homebound get their second dose vaccine, especially if they got their first dose via door-to-door outreach?
So I know there's definitely different groups that are going to be working to vaccinate homebound seniors. So EMS, and various different groups. So if seniors get any kind of home care, there's different organizations that will be looking to vaccinate them. And I think as folks get notifications, emails, phone calls regarding their second dose, and I think there will be ways to identify if you're not able to come in, and reaching out to different organizations such as TNO and different facilities or family doctors that help to facilitate your first dose. So I know it's not a clear-cut answer, but folks should be hearing within the next few weeks at the 10 to 12 week mark from their first dose about getting the second dose. But if you are falling through the cracks and no one is reaching out, then make sure you contact your family doctor or the organization that had given you your first vaccine. And if, someone is in touch with a senior and, lives next door to a senior, check in on them and ask, and, just make sure to facilitate to ensure that they have a way that they will be getting it. Janine, I don't know if you have, or Dr. McCready, I don't know if you have anything else to add to that.
Yeah, I think I think everything that you said, Dr. Shah, is totally exactly, as it is. I think for anyone that's younger and lives with an older person, keep your ears and eyes open. And I think, there is a plan, within the next 2 weeks as we get direction from the province, and we're kind of told at the same time sometimes as the public is, and then we're making plans kind of in advance of that to how we can make sure the rollout is good for the second doses. But everything evolves, very quickly. And as soon as we're kind of allowed to roll it out more broadly, then we do. So I think the plan will be to reach out to people, but keep your ears and eyes open, and check things like Twitter, check the groups here from TNO, because if we are allowed to start giving out more second doses to younger age groups at the pop-ups, if there's more vaccines, then we will start doing that as soon as we possibly can as well. So I think that just making sure you're paying attention, and if you haven't heard anything, then please do reach out if you've gotten to that kind of 14-week mark after your first vaccination.
Thanks so much. This is really helpful.
And then Dr. McCready, so the provincial system is going to be allowing 12 plus to start booking their appointments through that system. So will pop-ups continue to happen in our community? And why are they so important to our communities?
Yeah, no, 100%. So definitely the pop-ups will continue to happen because we do think it's very important for there to be multiple different ways for people to get vaccinated. Some people would prefer to book an appointment and go to one of the vaccination sites, and other people would prefer to go to their local community or their local school. And so, we've made that a priority to make sure that we can continue to provide that because we know that some of these, we need different strategies for different people. And we know that, the Toronto Public Health Mass Immunization Centers, there actually isn't one locally in our community. So we do have the Thorncliffe Park Hub, and we intend to keep that as a place that, hopefully we can target second doses at the Thorncliffe and Flemington community and give that as a great option for people to go to. But we intend to keep doing the pop-ups as well. I think that when we when we first heard that youth were allowed, the first thing I did was text my contacts at Toronto Public Health and the Hospital for Sick Children and Women's College and other places and say, we need to do this locally. We need to be able to bring it to the schools to make it easier. And if people want to go to the, book an appointment and they can get themselves to the big immunization centers downtown, wonderful. But if they can't, we have to make it easy for people. And that's been the plan. And so I know, we get a lot of questions in the youth forums and at the youth clinics. Well, how am I going to get my second dose? And we don't give out necessarily second dose appointments when you have your first dose when you come for your, especially at the school pop-ups. But we plan to actually be able to go back and do more clinics in August, back at the schools to be able to get those second doses in. And so far, the government direction might change, but so far their plan is to try and give second doses for the students 2 weeks before school starts in August, so that most of them can have full protection at that stage. But if you prefer to book at, say, the Thorncliffe Park Hub and get your second dose, that's okay too. So I think that we really want to keep this mixed strategy to try and make it as easy as possible for people, and we've really seen that it's important to provide opportunities that people are comfortable with in the community.
Great, thank you. So this is actually a good follow-up. So a lot of folks have gotten their vaccine at the pop-ups. And unlike the provincial system where they're actually told to book in a second appointment, how do we ensure that folks in our community are getting their vaccines in the right time? And if there is an issue, who do they call? What do they do? So maybe either or, if we could sort of let folks know what steps they need to take.
Yeah, so because the government's just kind of made this announcement, I think things are going to evolve a lot in the next few weeks. So I think, the first thing is that, as Dr. Shah said, check your email, check your text messages. You may get a message from the hospital reaching out and saying, please book your second appointment. And then there also may be, announcements made that saying this is when you're, eligible to book. If you got vaccinated during this time, like they're doing with AstraZeneca right now, saying, you're now eligible to book. So I think it likely will be a combined approach. You do not need to worry. People that got vaccinated through pop-ups are not going to be left out. You're not forgotten. We have discussions about it every day and what the easiest way is. The challenge is that we probably won't go back exactly to, the lobby of your building to give you your second dose exactly at the certain time, because it'll be, very challenging to capture the same people that say, if you went to Iqbal's on this Saturday, okay, now the people that went to Iqbal's on this Saturday come on this day. It'll be very challenging to do that. But I think the plan will be kind of a mixed approach. So there'll be some booked appointments at the Thorncliffe Park Hub that you'll be eligible to book. And then we will still be doing pop-ups in the community. And then we'll be able to open those up. They'll still be for first doses, but if you are within the groups that are eligible for second doses, you'll be able to get your second doses there. And I think the important thing too is it all goes into this big registry for the whole province called COVAX. So if Dr. Shah saw you at outside Iqbal's and vaccinated you, and then you decide to get your second dose at Scarborough or at the Thorncliffe Park Hub, it all goes into the same system and it gets recorded, and we know you're fully vaccinated. And if we look at it and we say, okay, we open it up and then we find, okay, look, there's these like 100 people that haven't got their second dose, then we can kind of figure out, well, why haven't those people got their second dose, and then really try to target and reach out to make sure everybody can get the second dose that hasn't received it yet. So you won't be forgotten for sure.
And I'm just gonna pop in here to say, if by chance you hadn't heard from someone after the 12-week mark, what should folks do?
Yeah, so I think, if you're at up to 14 weeks and you haven't heard anything, then there is a East Toronto Health Partners email. So I think, reach out to them. And then if you have a primary care physician, if you're affiliated with HATP, like certainly reach out to them. Dr. Shah has more information up to date than everybody really. So, reach out to your primary care provider, reach out to the East Toronto Health Partners, reach out to TNO, contact one of your local partners, and they will find out for you. And then, check local message boards. And I think things are going to evolve very quickly in the next month in terms of second doses. And a lot of it is just that, we're allowed to do what we can do as the province allows us to open it up. But we're going to get those second doses out to people as fast as we're possibly allowed to. And Dr. Shah, I don't know if you want to add anything.
Yeah, I don't have a lot more to add. I do know that we are pulling from COVAX on, as Janine or Dr. McCready mentioned. There's a provincial database of all vaccinations, and we know which site, which institution, and where it was given. But we can pull from Michael Garron Hospital, and all the different locations that vaccines are given by date, and so to figure out when we're emailing to book for second doses. So that will be something that we're going to be looking into, but a lot of it's evolving sort of as we move along and get supply with vaccines and get guidance from the government in who we're going to prioritize. But yeah, and also as family doctors, we're always happy to help. I've often been proactively contacting my patients to ensure they're getting their first dose. And then, and we'll be doing the same in terms of second doses. So we're always happy to help advocate for our patients.
Great. The next question is about, I'm just going to read the question so I make sure that I capture it. Pfizer, in one of their reports, indicated vaccine efficacy after 2 doses, which is about 6 to 8 months. With most of us getting our second dose after 3 to 4 months, does that mean in another 3 to 4 months after the second dose, we would need to start all over again? So I think it's really asking about the booster. After the second dose, are we going to have to get a booster?
I can take that one. I mean, I think the main point is that the information is still evolving. So I think that it's going to be, right now we don't know how long the immune response is going to last. I think that the very promising thing and the good thing is that, so initially, as Dr. Shah said, the vaccines were studied at either for Pfizer a 21-day interval and then for Moderna a 28-day interval. But since then, they've actually done other studies where they've lengthened that interval up to 12 weeks. And it actually showed that the vaccines were even more effective and longer lasting. So it boosted your antibodies by more. And the expectation is with that extended interval, you're going to actually have protection for longer. So the way, the decision that Canada made to extend that interval to protect more people actually may end up giving individual protection for longer as well. So really, a huge bonus. And I think the way we understand vaccines working, that certainly makes sense. That it does make sense to extend that interval and to have it longer boosting. In terms of how long it's going to be before we need another booster, really, there's a lot of different research that's going on right now to try and figure that out. So there's people that are looking at groups and testing their antibodies and seeing how long that lasts after their second dose. And that will continue, and people will be continuing to look at that. I mean, the United States is a few months ahead of us in terms of most of their vaccines. And so they'll be able to look at people that got the vaccine on like a 3-week schedule, and also that got it at longer, and when you need that booster. And I think there's lots of components involved in immunity and how long that lasts. And so, I think that will we likely need boosters? Yes. I think that it's unlikely that, this is a 2-shot deal and you're protected forever, especially with the way that these, the variants of concern, can develop, and that the rest of the world is not as lucky as us. So those variants are going to continue to develop. And I think it'll be unlikely one of them comes along that escapes the virus or the vaccine altogether, but we probably will need to modify it. But I don't think I think it's unlikely it's only going to be for 6 months. I think what we know so far is that it does protect for 6 to 8 months, but it's not only, it's at least, because it's only been that long. So they'll, every month that goes by, they're going to check for longer. And then at some point they'll see, okay, it drops off a little bit, but it's not only 6 to 8 months, it's at least 6 to 8 months at this stage.
Perfect. Okay, and this is our last pre-submitted question, and then we'll get to our Q&A box. And you kind of touched on this, is, again, with emerging variants coming up all the time, we're hearing all of the new variants, is the vaccine protecting us against these variants? And it's open to either Dr. Shah or Dr. McCready.
So I think the most recent studies that I have read with AstraZeneca and Pfizer have shown that after 1 dose, both are 33% effective against the variants. So the variant that originated in India, and then after 2 doses, it jumps up to between 60 to 85% against the variants that originated in India, but and then the UK variant, the efficacy is 95%.
Yeah, I think the important thing, like this, I totally agree with Dr. Shah in terms of preventing all disease. But I think the important thing to remember is even if the efficacy has gone down a little bit for those variants and you still get COVID, you're still like almost 100% less likely to end up hospitalized and end up dying. So even though the efficacy has dropped a little bit with the variants, it's still extremely protective against death, which is, and hospitalization, which is really the most important thing. Obviously, we want it to be totally effective at preventing it altogether. But if you're vaccinated and it turns what could kill you into a cold, that's amazing, right? So I think, we have to focus on that. And, the variants of concern are certainly something we should pay attention to and not take lightly. But I think that these, after 2 doses of vaccine, they're still very effective at preventing disease and preventing death.
Great, thank you so much. So now we're going to shift a little. If you want to take a little water break, we're going to go to our live Q&A. So again, please type your questions. We'll just read them and answer as we go. And we'll start with the first one. Is how much is the effectiveness and safety of the first dose? Why most people are afraid that after the second dose, they will face major side effects? And then is there a vaccine hesitancy among people that after their second dose and during 1 year will die? So Dr. McCready, I see that you're typing, but I'm wondering if you could answer that for us live.
Yeah, perfect. It's much
Thank you.
easier. I was started typing.
Yeah, perfect.
So in terms of the first part, so effectiveness and safety of the first dose. So the safety, the mRNA vaccines are extremely safe. So to date, I mean, there's been probably, I don't know, almost 1 billion doses given out worldwide, at least several 100 million in the United States. And after the first dose of those vaccines, really no safety signal for anything significant. You can have allergic reactions. They're very rare and they're treatable. So, very, very, very safe. And the effectiveness of just 1 dose, it depends. It's hard to give like a clear, just set in stone answer. It depends on how far you are out from the first vaccine. It depends how old you are. And it also depends on how healthy your immune system is. So, if you're at least 2 weeks out from that first dose, you will have some protection and you're much less likely to get severe disease and die. But it also depends on the type of variant of, whether you have a variant of concern. So it's not as clear cut to say, oh, it's, 33% effective or 50%. I think it's, there is definitely some partial protection, but still important to wear a mask, distance, be careful if you've only had 1 dose. And then certainly after 2 doses, if you're 2 weeks after your second dose, that's when those efficacy numbers of kind of 95%, 100% at preventing severe disease and death, that's where those numbers come from. In terms of the questions about, why are people afraid after their second dose to have a major side effect or that you're going to die after your second dose? So, in the studies and also in monitoring worldwide of all these cases for Pfizer and Moderna, the side effects have been extremely rare. The only thing besides very rare allergies that we've seen to date that would be kind of remotely serious is this rare possible link to having inflammation of your heart. And almost all of those cases were very mild and people, got better very quickly. So very rare. I wouldn't be at all worried, wouldn't be worried about dying after a second dose. And I think in terms of the people have concerns about the long-term safety of it. So there's a few things I think that are important with that. So one is that, I know people raise concerns. So this all happened very fast. We created the mRNA vaccines, in less than a year. But I think it's very important to remember is that the technology for the vaccines, that mRNA, there's been people doing research on that for decades. And they were trying to do vaccines for Zika virus, for influenza, for another virus called CMV. And they've been looking at that technology for decades. And there's no long-term issue or no long-term safety signal in any of those studies. So I think that is very important. We do have that data that has shown us that there is nothing that has shown up for the, basically decades they've been working on this technology. And also the way the vaccine works, the mRNA is kind of like it's like a recipe. So it comes in and it shows your cells a blueprint, and then your body takes that little picture of the spike protein and makes the antibodies for it, and then the mRNA vaccine disappears. So it's gone. It doesn't integrate within your cells. It doesn't go into your DNA. It's just disintegrates and is gone. It's completely not in your system anymore. So any long-term side effects would have to be related to your body's response to the vaccine. And we see, you know, your body doesn't keep building an immune response months and months later. If you're going to have any immune response to it, it happens within usually the first 4, if not 6 weeks of that vaccine. So it would be extraordinarily rare to have any issues, you know, really past that 6-week mark. And now that we have people that have been vaccinated back to December, you know, we have the real world evidence that it's very, it's safe over this timeline. And if you look at, you know, all the vaccines throughout history, there's been nothing that has caused long-term effects. Any side effect that was all found within the first six weeks post-vaccine. And so I know a lot of people have been very nervous because of what happened with AstraZeneca and all the mixed information and all the information that we learned about different, about the clotting issue. But the good thing about that is that we learned about it. And so very quickly, that safety signal was demonstrated. People saw that, okay, something is maybe going on here. We need to learn more, and then we need to reevaluate. And so I think that the system works. And so if there was a similar issue with Pfizer or Moderna, we'd be picking it up by now. And even with, to give you a word on AstraZeneca, I mean, with the first dose, we're not giving any new first doses. You know, the risk of clots is still low. It's, you know, it's kind of one in 25,000 up to 1 in 100,000. And if you are one of those people that's getting a second dose of AstraZeneca or waiting for that second dose, the risk of a clot and that rare side effect with that is somewhere between 1 in 600,000 to 1 in a million. So much, 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 much more rare with the second dose. But those are a different type of vaccine than your Pfizer, Moderna, mRNA vaccines. They don't work at all the same way. So there's no, you know, clotting, similar clotting risk with those ones. So that was a very long-winded answer, but
no, that's okay. It was 3 questions in one, so it wasn't long-winded at all.
The only thing that I'll add, I don't think you touched on this, was that, you know, there are very common side effects from the vaccines, which is muscle aches, maybe a slight fever, malaise, that lasts up to 48 hours, and it can be after the first or second dose. But, you know, in my opinion, and as a physician, that's a good thing. That means your body is mounting an immune response and building antibodies so that if you were to get COVID, it would be able to fight COVID quickly, and you really wouldn't, you know, you may not even feel it if you were to get COVID in the future once your body has mounted that immune response. So that, you know, there are side effects that are common, but they are nothing serious. And really, it's a sign that your body's mounting a good immune response. And these are the same side effects that we see in children when they get their vaccines at 2 months, 4 months, 6 months, 1 year, 50 months. They're nothing new and that we haven't seen over the years.
Great, thank you so much. I think this question is, if someone has been vaccinated in another country with their first dose, can they get their second dose here? So Dr. Shah, do you want to take that? Give Dr. McCready, we'll go back and forth. Yeah.
I would just suggest that you reach out to your family doctor, talk to them about what dose you got, when you got it, and your family doctor would know if you have any other medical issues and when you'd be eligible to get your second dose, and they can give you guidance on when to get it and how to get it. But yes, for sure, you are eligible to get it here for your second dose. And we're also in the process of figuring out how to register on the Ontario system for that first dose that was received elsewhere. So we will get further sort of communication on how to do that.
Okay, great, thank you. And then the next question is, how many days after first and second dose protected, I guess, how protected are you from COVID?
So the vaccine takes really 3 weeks to work effectively after the first dose to get that full immune response that you get from the first dose, and then another 3 weeks after the second dose to even get the greater immune response from both doses combined. So for sure, but even beyond that, you should continue using all sort of the precautious measures that are recommended by the government, you know, based on the COVID count in your region and area.
Great, thank you. The next one I think we already got, which was about the booster and the 3 to 4 to between the 6 and 8 month regimes. So I'm gonna, we've answered that one. The next one is for folks who got their first dose earlier in late March, late February, early March. They are past their 12 weeks and are yet to receive their second dose appointments, whereas folks who booked their first dose through the province city website have official second dose dates. And can we now reschedule to earlier from tomorrow? How does East Toronto Health Partners, Michael Guerin, HATP plan to address this equality? So I know we've sort of talked a little bit or touched a little bit about this, but if there are any follow-up comments that either of you would like to add?
I think, you know, I think there's definitely individual circumstances for different folks who got vaccines at different times, different age groups. And there may have been some, likely not many, that received them very earlier on who are not part of the age priority groups that are currently being offered their second dose. What I would suggest is that you speak to your family doctor and ask them sort of to get guidance on what to do and when you are eligible to start asking more questions about your second dose. And if you're past that 14-week mark, as Dr. McCready has suggested, from your first dose, then I would reach out to the place that you got your first dose, that organization, you know, just to see where you would be put in line to get the next one.
Yeah, and I the only thing I would add is that, you know, a lot of the provincial booking, it books you for your second dose automatically, but that doesn't necessarily mean that they're going to get their vaccine earlier than if you had it at a pop-up, because they're still going to, you know, go through it, and it's going to be dependent on supply. But for example, for the 80-year-olds that were done through MGH, you know, the East Toronto Health Partners we're going to be actively reaching out to those people and booking them in. So even if they haven't been booked for a second appointment, if you booked through the provincial system, you would have been booked at 16 weeks for your second appointment. So the hope and the plan is that the people through MGH and through East Toronto Health Partners will be at the same time or earlier. It's just that, you know, the goalposts have been moving based on the government recommendations, but it's not as though just because you don't have that date in your hand, you may actually get it earlier than if they were booked at the 16 weeks by the province.
Great, which is kind of what which is the next question you just sort of answered. What happens to folks who do not get contacted and or get their second dose in the 16-week period? But
yeah, the only thing I would say about that, so it's not like a max. If you don't get your second dose within the 16 weeks, it's not as though all is lost. So, you know, the 4 months was just what the government, you know, what NACI decided, we're going to increase that interval, but your immunity is still there and is still building. So if you get boosted at, you know, 12 weeks versus 16 weeks versus 20 weeks, it's the change, the difference is going to be marginal. So you're still going to be protected. Your protection is going to be, you know, potentially longer because you're going to have, you know, a longer boosting. So I wouldn't be, you know, petrified if it's a little bit shorter or a little bit longer. It's all going to be within the time frame. Just like for kids, you know, when you give measles, mumps, and rubella vaccine, you know, you get your first dose around 12 months, and then your second dose in Ontario around 4 to 6 years. But in sometimes in other provinces, they do 12 months and 18 months, and they're still, you know, protected. So it's not, you know, the way vaccines work, it's not as though at 4 months and 1 day your immunity's gone and then you got to start over. You're still going to be boosted if you get it a little bit later, or if, you know, I know I've heard from some people that are traveling around now and they're afraid about the timing. When you come back to Canada, then, you know, reach out and get your second dose and it'll be just fine.
Great. Next question is, my first AstraZeneca dose was at Shoppers Drug Mart in early April. The recently published charts say I'm eligible for my second dose starting June 28th, which is 12 weeks later. Do I wait for a notification from Shoppers Drug Mart to book my second dose?
So I can answer that. I think the AstraZeneca supply, it's a little bit unknown currently if and when we're getting more AstraZeneca to be able to offer folks for their second doses. And so we're starting with the folks who received it earlier on and offering it there. And just being honest, we don't know what the supply is going to be of the vaccine. But the good news is that we're going to be likely able to mix doses, or we are going to be mixing doses, especially if we don't have AstraZeneca to offer, and offering Pfizer or Moderna as a second dose. And the good news is that there are studies underway that have really shown promising results, that getting a different vaccine after AstraZeneca, so getting Pfizer and Moderna, is safe and effective, and just as effective, if not more, than getting 2 doses of AstraZeneca.
Okay, great. Thank you. Next question is, if someone is allergic from their medical mask, what should be done if it is mandatory in the workplace?
I mean, I think that, in terms of the individual, I think you could, speak to your primary care physician. It would be really the first thing to do. And I've had people that we've worked through issues with this where they have an allergy and they're not actually allergic to all the masks. It's, certain ones. And so they've tried out different ones and they found one that can protect them and that they don't have, an allergic reaction to. So I would reach out to them. There's lots of different reasons for allergies and reactions, and there's also the possibility of seeing, a specialist in that area. And with our work in the schools, I've actually worked with a number of teachers who had certain reactions to the ones that they were getting from the school board, and then we found them another type of mask and they were okay. And I think, in terms of vaccination, it's even more important for someone like you or for someone like that person to get vaccinated, because then once you have your 2 doses of vaccine, you're going to be much more protected. And so then if you're in close contact with people and working in a workplace where you are exposed to others, that vaccine is going to provide you that protection. And so will allow you then to not be as reliant on the mask for protection. And I don't think it's as simple. Sorry, I see the comment there. I'll just address it now. That doctor refused to give a letter. So it's not, I don't think it's as simple as not wearing a mask or wearing a mask. It's probably complicated. And that it's there for protection for you and for the other people. So really important really to get vaccinated, and hopefully in the next few months, then, the masks may not end up having to be mandatory any longer if enough of the workplace is fully vaccinated.
Great, thank you. Next question, we kind of addressed this earlier, but it would be great to revisit, is how long do we think we may be following public health guidelines, so masking, cleaning, sanitizing, after 70 to 80% of the population is vaccinated?
So, I think the hope, it'll depend on many different things, but our hope is that if a large proportion of the population is vaccinated, COVID case counts go down, hospitalizations go down, admissions to hospital go down, and then folks start receiving their second dose. And, as things improve, that eventually people will be allowed larger outdoor gatherings, larger indoor gatherings, kids will be allowed in school, and we can sort of slowly ease back to the way that we once lived. I think we will be following our public health guidelines no matter what, but they will reflect, so in terms of mask wearing and the number of people allowed in different vicinities, they will reflect what the rates of COVID are, what the hospitalizations are, and how many people are vaccinated.
Great. And then this is our last question for Q&A for today. And the question is, if someone gets their second dose earlier than the 21 days, what happens?
So nothing bad will happen. So you won't, you wouldn't get any more likely to have, worse side effects or anything, terrible. But the concern is, and the reason it's dosed at that interval is to provide your body with adequate boosting so that your body forms an antibody response and basically shows some protection against COVID, and then you get your second dose, which then boosts that further. So, if it's a few days before the 21 days, it's probably still going to be the same, similar effect and similar antibody response. But I really wouldn't, advise you to try to do that because it's not going to provide you as long-term protection as you would have if you, wait to have it on as it's prescribed or as the way it was studied, or potentially even longer, because what the new studies have shown is that actually if you wait a little bit longer, then you're probably going to have protection for longer. And at the beginning, when we were just rolling these out, especially in January, a lot of healthcare workers got them on the around the 3-week mark, and we were doing that because there was in the midst of seeing many COVID patients in hospital. And, I was lucky enough to get mine kind of on schedule back in January, but, now knowing what we know about it, it's a balancing act between getting full protection early, but also making sure that your antibodies last a long time. So I think that, obviously get your first dose as soon as you can. And then, if your second dose is somewhere is around, anywhere past that 21 days, but maybe closer to the 12 weeks, then that's actually probably beneficial for most people to give them longer protection.
Great, thank you so much. So we're going to give our physicians a little bit of a break, and we are going to pass it over to our phenomenal community ambassador, who's going to share a little bit about her experience. So again, welcome, Tabasum. So my first question to you is, can you share with us your experience working as a community health ambassador?
Hello, everyone. Thanks for having me today. My name is Tabasum Mohammadi. I've been living in Thorncliffe Park since past 13 years. I have 4 kids and 3 boys and a girl. I'm the lead TNO community ambassador for Thorncliffe. I actually started as an outreach worker for TNO, where different kinds of outreach were involved, like door-to-door flyer distribution in buildings, posting flyers in building lobbies, bus stops, businesses, crossing poles, and definitely on social media platforms like Twitter, WhatsApp, and Instagram. The TN ambassadors, along with Toronto Public Health, had also run COVID-19 vaccine awareness workshops to educate the community residents and have information from the right sources. Currently, all our community ambassadors are vaccinated and serve as a role model for the community members when they do their outreach work. And also our TN ambassadors also go door to door to do flyer distribution, as well as answer their concerns and help the residents register for their vaccine appointments. There are certain challenges we face where we get only a day or two notice that we have a pop-up clinic in our area, and we have to just go running around doing door-to-door outreach.
For sure. And why did you feel it was important to do this work? To help residents get vaccinated? What prompted you to do this work?
Keeping our community safe was the priority. Initially, when the COVID had affected the entire world, actually, everyone were in lockdown, and the whole community was in lockdown and no one was going out. They had no resources. They didn't know where to go. They didn't know the testing sites. So we had to spread awareness about the testing sites. So we distributed flyers. And then about the vaccine, it was important to keep our community safe, because Thorncliffe is a very close-knit community where there are many people living in the building, even in the elevators, when they have no patience. It's hard because we just have 4 elevators for 21 floors, and we have to get people vaccinated and keep them safe. It was really crucial.
So to follow that up, what was your experience getting your vaccine?
Oh, mine. I first did my homework. First, I learned a lot about vaccine. I tried to get as much knowledge as possible because I also work in a special needs school. But I work with Holland Lorview. So the entire staff had been vaccinated in January. But I still wanted to wait a little bit because even I was hesitant as everyone else was. But then when I saw they had no side effects and they were all doing well, then I spoke to my husband and we were ready to get vaccinated. The Michael Garron Hospital people came in our building. They did door-to-door vaccination in 43. So me and my husband got vaccinated. My 18-year-old son, he got vaccinated as well.
Great, thank you. And then also, I know you've been working at many of the pop-ups. Could you just sort of explain the process if someone is going to come to a pop-up? What should they expect?
Recently, there are no long lines anymore because many people have been vaccinated. So please expect there are no long lines. You don't have to wait. Maybe just 20 or 30 minutes max. Because like today, they had to just wait for 10 to 15 minutes and they were in. They got their vaccine, waited for 15 minutes for observation, and they were out, and they got free ice cream as well today.
Who doesn't want to have some free ice cream? And Tabasum, if there was a message that you could share with the community, what would one of your messages be as someone who's interacting with residents, who's on the ground, outreaching, connecting with folks? What would you want everyone to hear, your one message?
My one message, just tell them that it's very important to be safe. Think about your family and friends, and we want to get out of this mask and we want to lead a normal life like before. Thank you so much.
Thanks, Tabasum. I'm going to pass
you.
it over to Iman.
Thanks, Meera. So I just have a few resources to share with everyone. So as we are, as the vaccination rollout is taking place in full swing, just a reminder that we do have our COVID-19 temporary testing sites running. So we have the two locations at Flemington Park, which are Angela James Arena and Dennis Dimbrell Resource Center, and they are running at alternating schedules. And then we have another testing center at the Tiano Youth Center in Thorncliffe Park. We have a few other locations in other parts of East Toronto, and you can find this information on this COVID webpage. We will be updating the schedule for next month, for the month of June as well. So this is up until May 31st. So any changes in this in the COVID testing schedule will be posted on this webpage as well. For anyone who is looking for resources, particularly around accessing food, any senior that needs additional support, please feel free to reach out to our community hotline number that is on the screen right now, 647-477-1640. And this you can call this number even if you are you have tested positive for COVID-19 and are looking for additional support, particularly around rent, income assistance, groceries, childcare, etc. So this is our community hotline number, and you can call this number, and they will be able to redirect you to appropriate staff. Also wanted to bring our attention to this resource on the Michael Garron Hospital webpage. And this is basically like a repository of all the mobile and pop-up vaccine clinics that are happening in East Toronto. And this is updated regularly. So starting the first one we have over here was the one that happened on Friday, May 28th. And we have like multiple locations at various schools as well. And it goes all the way up until, I want to say, June 5th. June 6th. So there's a lot of great information on here. So where the pop-up clinic is happening, the address, who the clinic is for, so priority access as well as non-priority access, timings, a number of doses, and just some information on how you're able to get your vaccine. So this is for first dose for now. Again, I can drop this link in the chat box. And also wanted to bring your attention to the self-scheduling page that's also available on the Michael Garron website. So if you'd like to schedule an appointment for yourself at for first dose at 45 Orly Boulevard, so this is at East York Town Center, you can visit this link and you can schedule an appointment. And it's pretty simple. So right now I see that there are no time slots available, but this is updated regularly as and when time slots become available, and that really depends on vaccine supply. So you can go ahead and you can visit this link and schedule an appointment for yourself. So just a few questions that you have answered, and you get a confirmation on your email as well as your phone. And if you need help scheduling this one, we can also call the community hotline number and they can do it for you. So that's all from me. Over to you, Meera.
Actually, I'm going to pass it over to Dr. McCready. I think she wanted to share some upcoming clinics in the neighborhood.
Perfect, thank you. Yeah, so we kind of highlighted these a little bit, but I just wanted to really highlight the ones that are happening this week. So today, I think there's vaccine clinics still going on at the park right beside Thorncliffe Park School. Tomorrow tomorrow's Monday, May 31st, and that is happening at St. John's, Blessed the 23rd. So there we go at 175 Grenoble Drive. So it's open to anyone 12 plus, but really priority access for anyone that works or lives, and especially if you attend school. So if you're at St. John's or Mark Garneau, Valley Park, or any of the schools, siblings, or you're just turned 12, come get your vaccine. And then the next day, so that's for Monday. Then on Tuesday, we have a clinic at Grenoble Public School. So again, open to all students, family members, anyone living in M3C and M4H. And then on Wednesday, so we've got 3 days in a row. Wednesday is in the Thorncliffe Park side, so at Thorncliffe Park Public School. Again, for any students, families, everybody in the area. And they all start at 2 p.m. and they all have a lot of doses. So they all have 500 doses. They all say 2 p.m. until they run out of vaccine, but please come. The lines at all of our school pop-ups lately have been fairly short. The initial ones we did at Mark Garneau were very busy to begin with. So hopefully if any of you came, you didn't get overwhelmed and not come back. But recently the clinics, we've been able to get through people as we heard, not a long wait at all. So please do come, and we're trying to make it easy. So drag someone along with you if they haven't been vaccinated yet. And then hopefully we'll be able to get more information to you out about second doses in the next couple of weeks as well. Thank you so much.
Great, thank you so much. So we've just got about 10 minutes left. So as we close, I'm going to open the panel discussion again to our panelists for any closing remarks, any messages that you want to share with folks. And I'm going to leave it open to anyone that wants to start.
I can start and then I'll let Dr. Shah have the last word. Thank you for taking the time this afternoon to ask us questions, to learn about the vaccine. It's great that you are wanting to learn about, how to get the vaccine, questions about the vaccine. And my request would be that if you've learned anything and you feel like you have a useful information, to go out and share that with other people. And if they have concerns about the vaccine or they've seen things online, try to bring them back to the facts. So tell them what you've heard here today, and if help them find resources online from really trusted sources, from Health Canada, Public Health Agency, from the hospital websites, Canada Immunize, places that have reputable pieces of information, because I know there's lots of different things flying around out there, and it can be very scary to navigate. I promise you that this year has just been incredible in terms of all the things that everyone has gone through. And I never thought that, a year ago that we'd be in a situation where we have these vaccines that are so amazing and so effective and so safe that they could actually give us the hope that we can get back to, seeing our friends and family without worrying about giving them COVID, get back to doing the jobs that we need to do, get back to kids being in school. So, it's these vaccines are amazing. They really are, and they're here to protect all of us on an individual level, and also on a whole community level, and a whole, city, province, country level, to help us all support each other and get back to normal. And, everyone, if you just think, oh, I'm just one person, it's not a big deal. I mean, certainly it's important to protect you, but every extra person getting that vaccine is going to do a huge amount to get us out of this. And we can't do it unless we all, are in it. So, just thank you for joining. And if you can convince, share the information with one other person, then and our time was well spent today. So thank you very much for having me. I appreciate it.
Thanks, Dr. McCready. All right, Dr. Shah, it's all you.
I'll echo everything that Dr. McCready said. I personally have been vaccinated, as have all my family, and my daughter, who's 12 years old now. She's been vaccinated, all of my extended family. And so on a personal level and an individual level, it's worthwhile doing. It's safe, we're all here, we're all fine. And on a mass level, I think we really need to think about this as a community, and we want our kids to be back in school. I would like to see all my patients in person and not be calling them on the phone constantly, though the calling is good. But, I would like to return to normal. And so on a larger scale, everyone who just puts their arm out to get vaccinated, the closer we get there. So echoing what Dr. McCready said, and in terms of the second doses, I know there's a lot of anxiety out there about how and when I'm going to get my second dose, and will someone contact you to get it. So, we are trying, we're learning, this is our first time doing all of this, but we have a system. It is in place. And as we get guidance from the government, we will be reaching out, and Michael Guerin will be reaching out. And if things do fall through the cracks and, there are people that aren't receiving it, then, that you can always contact ETHP, Michael Guerin Hospital, or the health partners and ask more questions.
Great, thank you, Dr. Shah. And Tabasum, any last thoughts or comments?
Yeah, I just want to encourage everyone to get vaccinated, even if people who are listening right now, if they're vaccinated, please encourage your friends and family and neighbors to get vaccinated. Let's help our community be safe. Thank you so much, guys.
Thank you so much, panelists. What an amazing amount of information that you've shared. Iman, I've seen that you've put all the resources in our chat box, so please feel free to share that. I will continue to echo everyone else, getting vaccinated, getting the community back to normal is so important. We will continue to run these sessions as, folks continue to have questions. Our next monthly forum will be Sunday, June 27th. It will be the same time. We'll have the same thing. So if you have questions, don't wait for the last minute. You send them. We're checking our inbox all the time. info@healthaccesstp.org. Give us a call. Please, let us help walk through some of your questions if you need. And if we don't have the questions, we'll go to the folks who do know the answers to those questions. So let's continue to have the conversation. And if there are no other final thoughts, Iman, did you want to add anything as our final thoughts?
Yeah, thanks, Meera. So thank you to the panelists who shared some great amount of information today, super helpful for everyone. And just wanted to also echo what everyone said. Please go out, get vaccinated, so that, we can move to a healthy and hopefully a just recovery soon. Thank you.
Awesome. So with that, we close today's session. If no one else has any questions, enjoy your Sunday evening. Go for a nice stroll in the sun, and we'll see you in a month. Bye, everyone.
Thank you. Bye.
Bye-bye.